Welcome to another nursing review on pharmacology. Before we begin, let's see if you can get this question correct. When a client with stage 1 Alzheimer's disease is provided the cholinesterase inhibitor donepezil, also known as Aricept, what information should be given to them? 1. In order to sustain function, the client must take this drug continuously. 2. The medication does not cure the illness, but it may slow its course. 3. To check for toxicity, a monthly serum medication level must be taken. 4. The healthcare provider should be informed if the client experiences any muscle aches. Put your answer in the comment box below. Now back to the lesson. This lesson will focus on Alzheimer's disease drugs. We will first learn about the actions of this medication, adverse reactions, and contraindications. Alzheimer's disease drugs are used as treatment of mild to moderate dementia of the Alzheimer's type. Now let's discuss how it works. According to current theories, cholinergic neurotransmission deficiencies are the cause of Alzheimer's disease symptoms. By reversibly inhibiting cholinesterase's ability to hydrolyze acetylcholine, these medications are thought to enhance cholinergic activity. Memantine is an antagonist of the NMDA receptor. Alzheimer's disease symptoms are hypothesized to be exacerbated by NMDA receptors that are persistently activated. None of the medications appear to change how the underlying illness process progresses. Okay, now, let's move on and learn about adverse reactions. Alzheimer's disease drugs have adverse reactions of weight loss, diarrhea, anorexia, nausea, vomiting, dizziness, headache, bradyarrhythmias, hypertension, and constipation, specifically with memantine. Okay, now, this is crucial to know. Let's now learn about contraindications of this medication group. Patients who are hypersensitive to any of the drug's ingredients should not take it, as these medications may amplify the neuromuscular blocking effects of anesthesia-related neuromuscular blocking drugs such as succinylcholine. When taking medications that reduce the heart rate concurrently, use caution. Heart block is more likely to occur. Because NSAIDs enhance the production of stomach acid, use them with caution. Both active or occult GI bleeding and ulcer development are more likely. Patients with significant renal or hepatic impairment should use this medication with caution. When there is significant renal impairment or severe hepatic impairment, the medications are not advised. Patients with a history of asthma or COPD should use this medication with caution. Okay, so now that we have a good idea about how this class of medication works, let's now focus on the commonly used medications of this class, starting with donepezil hydrochloride. Donepezil hydrochloride is used for mild to moderate Alzheimer's dementia and moderate to severe Alzheimer's disease. The way this medication works specifically is that it increases acetylcholine levels by inhibiting the cholinesterase enzyme, which causes acetylcholine hydrolysis. Side effects are the following. With the central nervous system, side effects include headache, insomnia, and seizures. With the cardiovascular system, side effects are bradycardia and heart block. With the eye, ear, nose, and throat system, side effects include cataract, blurred vision, eye irritation, and sore throat. With the gastrointestinal system, side effects are nausea, diarrhea, vomiting, and gastrointestinal bleeding. Okay, excellent. Now let's learn about nursing actions for this medication. Give this medication at bedtime on an empty stomach. Monitor the patient for evidence of active or occult gastrointestinal bleeding. And monitor the patient for bradycardia because of the potential for vagotonic effects. With nursing actions comes patient education. Here are some points to teach the patient. Emphasize that while the medication may temporarily stabilize or alleviate symptoms, it does not change the underlying degenerative illness. Regular medication use is necessary for effectiveness. Encourage the patient and caregiver to notify the medical staff that the patient is taking medication prior to receiving anesthesia and to report any serious side effects or changes in the patient's general health state right away. Advise the patient to stay away from over-the-counter sleep aids and cold medications due to the possibility of enhanced anticholinergic effects. Memantine hydrochloride. Memantine hydrochloride is used for moderate to severe Alzheimer's dementia. The way this medication works specifically is that it antagonizes NMDA receptors, the persistent activation of which seems to increase Alzheimer's symptoms. Side effects are the following. With the central nervous system, side effects include stroke, aggressiveness, agitation, confusion, depression, dizziness, headache, insomnia, somnolence, syncope, transient ischemic attack, and vertigo. With the cardiovascular system, side effects are heart failure, edema, and hypertension. With the gastrointestinal system, side effects include anorexia, constipation, diarrhea, nausea, and vomiting. With the genitourinary system, side effects are incontinence, urinary frequency, and urinary tract infection. Okay, excellent. Now let's learn about nursing actions for this medication. Patients can either consume the capsules whole or open them, sprinkle them on applesauce, and then swallow them. Patients are not advised to split, chew, or crush capsules. Using this medication may affect renal function in older adults, even if their creatinine level is normal. So patients with significant renal impairment should not be given the medication. Since the patient might not be able to identify changes or communicate clearly, keep a close eye out for any negative reactions. With nursing actions comes patient education. Here are some points to teach the patient. Describe how the medication may help the patient keep function for a longer amount of time, but it does not cure Alzheimer's disease. Instruct the patient or caregiver to report any negative consequences. Encourage the patient to abstain from alcohol as it may lessen the effectiveness of the medication. Rivastigmine tartrate. Rivastigmine tartrate is used to treat mild to moderate Alzheimer's dementia and mild to moderate dementia associated with Parkinson's disease. The way this medication works specifically is that it increases acetylcholine levels by inhibiting the cholinesterase enzyme, which causes acetylcholine hydrolysis. Side effects are the following. With the central nervous system, side effects include headache and dizziness. With the cardiovascular system, side effects are bradycardia. With the gastrointestinal system, side effects include nausea, vomiting, diarrhea, anorexia, and abdominal pain. Okay, excellent. Now let's learn about nursing actions for this medication. Keep an eye out for severe diarrhea, vomiting, and nausea in the patient, as these conditions can cause dehydration and weight loss. Keep an eye out for signs of occult or active gastrointestinal bleeding in the patient. When using oral medication, take it both at night and in the morning with meals. The solution can be taken on its own or mixed with cold fruit juice, soda, or a small glass of water. Apply the patch once a day to clean, dry, hairless skin on the upper or lower back, upper arm, or chest in an area that isn't touched by tight clothes for transdermal application. Don't utilize the same site for more than 14 days, yet try to rotate sites every day. With nursing actions comes patient education. Here are some points to teach the patient. Instruct the caregiver to administer the medication in the morning and evening with food. Inform the patient that the medication probably slows future memory loss and that memory improvement may be slight. Inform the patient or caregiver about the best locations for patches and how often they should be changed. Emphasize how crucial it is to avoid using the same site for 14 days. Let's go back to that question we had in the beginning of the video. When a client with stage 1 Alzheimer's disease is provided the cholinesterase inhibitor donepezil, Aricept, what information should be given to them? 1. In order to sustain function, the client must take this drug continuously. 2. The medication does not cure the illness, but it may slow its course. 3. To check for toxicity, a monthly serum medication level must be taken. 4. The healthcare provider should be informed if the client experiences any muscle aches. The correct answer is 2. This medication does not cure Alzheimer's, and at some point it will become ineffective as the disease progresses. Did you get it correct? Alright, well that ends this video. Pharmacology doesn't need to be hard. Just remember what class the medication is under, and most of the signs and symptoms will be similar, as well as nursing actions and patient teaching. Good luck with your studies. Click here for another nursing video.